Hello, yo. It's been so long, man. Talk to myself, but who cares? Ah, gotta start physio, bro. And it's already 6:30. I gotta finish all of these chapters on the right side. Kind of cooked, but I think we'll be okay. Hopefully, I'm gonna start off with a practical first. The story and shit for now. Let's start the timer. Pretty cool. Yeah, I'm so hungry, man. I don't know if I can focus, but I'm gonna try finishing at least half of these physio like practical chapters here on the top right. If I finish half of these, and then I'm gonna order some food. Too lazy to cook right now. I could cook. I'm looking gonna order. Too lazy. I don't know. Let's see. Let's see. When the time comes, I'm gonna cook or I'm gonna order. Let's just start for now. Start the study. Actually, let me check the stream first. Yo. All right, I'm gonna just start, bro. Okay. Sensor examination. Determine if any component of the sensor is damaged. Following terms are covered. We do sensory to see if the sensor is damaged. Okay, no shit, bro. Anesthesia. Tactile localization is entirely abolished. Why are they saying it so like fancy words? Just say about like no touch and no feeling, bro. Tactile localization is entirely abolished. I'm memorizing that. Hypoesthesia, partial loss of localization. When touch produces painful, irritating, and tingling sensation. Okay. Analgesia. Okay. Absence of pain. Sensibility. Hyperalgesia. Okay, this is Gesia. Gesia is pain. Gesia is tactile. Gesia is pain. Analgesia. Absence of pain, sensibility. Hyperalgesia, partial loss of pain, sensibility. Hyperalgesia, exaggeration of pain, sensibility. Astrognosis. Loss of stereognosis? What is stereognosis, bro? I'd be tripping here. The neurologic ability to identify common 3D objects. Minds key. Sense of touch with that. Oh. Astereogenesis. No, how do you pronounce this? Stereognosis. Stereognosis. Doesn't seem right. Hold on.
Stereognosis.
Stereognosis. Stereognosis. Whatever. Paresthesia, sensation experienced in the absence of any outward stimulus. Sensation experienced in the absence of stimulus. There's feeling of pins and needles or numbness crawling over the body. Okay. Like paresthesis. No stimulus, but there's like pins and needles over the body. Whatever. At the end of the practice, we examine the following sensation: tactile sensibility, that includes touch, localization, and discrimination, pain and temperature, position and vibration, diagnosis. Okay. Seizure. Alright. Put this up from the right side. Okay, introduce myself. Assalamualaikum. मेरा नाम है Dr. Ahmad. मैं आज आपका मुआयना लूँगा। उम्मीद है आपको कोई तकलीफ़ नहीं होगी। अगर आपको कोई तकलीफ़ होती है, तो आप मुझे बता सकते हैं। आपका मुआयना उसी वक़्त रोक दिया जाएगा। Whatever, bro. Say that bullshit. Take your consent. Can I touch you? From the tests, one by one, with the subject's eyes closed. Ooh. Check orientation and time and place. Wanna do- Okay, close the eyes and then you ask these questions like, yo, what's your name? What time is it now? Where are you? What's the date? What's the day and date? What time is it? What's your name? Okay. Checking different sensations. Okay. Tactile sensibility. This includes light touch, pressure, tactile localization, and discrimination. What's the difference between tactile localization? What about the exact location of touch on the body? Okay, I need to discern that. What about tactile discrimination? Like maybe different between light and okay, maybe yeah. Okay. Let's just see. Tactile sensibility. Light touch. Touch corresponding point on a different part of the body on both sides with wisp of cotton wool. Pressure touch. Touch corresponding points on different parts of the body on both sides with the point of a finger or any blunt object. And ask the subject whether he feels the sensation of pressure, touch, or not. Blunt object. Tactile localization. Answer to localization. Okay, eyes closed. Easy. Tactile 2-point discrimination. Apply to compass. Alright, okay. So light touch. Okay. Light touch. Pressure touch. Light touch is like hold on, like with this cotton. Light touch. Pressure touch. Tactile localization. Oh, where did I touch? I touched here. And then 2-point discrimination. Yo, I can tell. Whatever. Pain. Oh, pain. Superficial pain asks the subject if you can feel a pricks of steel pin applied to different parts of the body. I can describe the nature of sensation. Deep pain. Feels deep pain when you press, squeeze muscle, bellies, calves, or biceps, or actively. Why are we trying to like hurt the patient? What's going on here? All right, superficial pain. I'm just touching, doing the shit. Deep pain. I'm like his biceps or some shit. And temperature. Take warm and cold water and 2 test. Different parts. He can just put his fingers inside. Cold water should be tested first. Cold first. I don't know why, but cold first. Should be tested first as a subject whether he feels warmth or cold. Sense of position and passive movement. Close his eyes, flex and extend one of his finger passively. Whether he feels any movement. If so, what type of movement it was. Okay, so I'm gonna like close my eyes. I'm like, oh, what type of movement? Oh, what am I doing? Move fingers of toes or toes of the subject up and down and hold it there. Ask the subject about the position of the part moved in the different joints of the body. Tested for sense of position and passive movement. Vibration, apply vibrating tuning fork, blah 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 to different provinces. Dorsum of great toe, lateral malleolus, dorsum of finger, and top of acromion. Diagnose answer. Close his eyes, give him some article, coin, pen, key, whatever. Ask him to name them. Only one hand should be good. Light touch. Oh, let's have a closer look at this one. Alright, for light touch. Can't really see it on stream. My apologies. Light touch, you got cotton bud, 2-point discrimination. Oh, it's pretty obvious. Pin prick. I wouldn't mind pricking some pins, people. What is this? Testing for position, sense, in the big toe. Am I gonna be touching feet tomorrow? Uh, Vibration sense. Okay. Cautions. Always approach the subject from the right side. Introduce yourself to the subject. Briefly explain the procedure. Consent. Gently. Perform the examination gently and carefully. Patient's eyes should be closed during examination. Oh, all of this should be. Forgot. Remember that. Each test should be performed on both sides of the. Always compare them. Thank the subject at the end of the examination. This is precaution. Like, oh, if I don't thank him, everything's gonna go wrong. Like, all the results are gonna be wrong. Some bullshit, bro. Anyways, relevant question. What is proprioception? Name its receptors. You have the answers on the right side. Awareness of body position, movement, receptors, muscle spindles, Golgi tendon organs, and joint receptors. What is joint receptors, bro? I don't like that. I heard this before. I'm tripping. I think I forgot it. Sensor nerves and joint capsules, the ligaments, that is okay. Real GPS. muscle spindles, Golgi tendon organs, and joint receptors, and awareness of body position and movement. All right, name the receptor for pain, cold, hot, and touch sensation. All right, pain is. How do you pronounce it, by the way? Nociceptors? Nociceptors? I've never really thought about that. Have a look. Hello. Pronounce this.
Nociceptors.
Nociceptors. Okay. Nociceptors. And cold. Cold and hot. Hot is rough in the endings. Cold is cross end bulbs. I don't like that. I don't like that. Hot is Raffini endings. Cold is cross end bulbs. Bro, I don't like cross end bulbs, bro. It gotta be something weird. Touch is Meisner's corpuscles, Merkel cells. Ay ay ay. Yo, how has it been 9 minutes already? Only on page 4. Touch is Meisner's. Okay, touch, Meisner's corpuscles. Pain is nociceptors. What else is there? Cold is claws end bulbs. Cross end bulbs. Cross end bulbs. Cross end bulbs. And hot is Ruffini endings. Now, what are Pacinian corpuscles? Deep pressure and vibration. I knew that. Subcutaneous tissue. Receptor for deep pressure and vibration. What is stereognosis? Ability to recognize objects by touch without visual input. Pretty cool. Define analgesia, anesthesia, hyperalgesia, hyperesthesia. Analgesia is unable to perceive pain. Anesthesia is localized tactile sensations. Absence of all pain. Okay. Hyperalgesia increases pain. Increased sensitivity to touch. Okay. Name the tract carrying touch and pain sensations. Touch and pain. It's the anterior lateral or anterior and lateral spinal thalamic tract. Spinal thalamic tract. Touch is both, bro. I'm telling you, I can pull up Gaiden right now and prove to you that touch is both. I'm not trying to do that right now, but I'm telling you, touch is both. 100%. Touch is both that. Dorsal column, medial lemniscal pathway. It's both. It's like, depends on the type of touch. Fine touch or crude touch. Crude touch is the spinal thalamic tract, but the fine touch would be dorsal column, medial lemniscal. Okay. What is tactile localization in 2? Okay. Tactile localization, being able to tell where the touch was made. And 2-point discrimination. Okay, know that. What is Brodmann's area? Brodmann's area number for primary sensory area and secondary sensory area. Primary sensory area is 1, 2, 3. Secondary sensory is 5 and 7. Okay. It was actually, I think it's 3, 1, 2 for primary sensory area, like the better way to say it. And secondary sensory area is 5 and 7. Okay. 2 and 2, 5, 7. Name the nucleus of thalamus for conscious sensation. Ventral posterior. BP nucleus. Conscious sensation. Differentiate between fine and crude touch. Fine touch precise, detailed, involves texture and shape. Crude touch general, non-specific. Precise, detail. Continuing forward with higher frequency, what do we use? Yes, higher frequency can be detected. And name frequency of vibration sense is lost. Diabetes, vitamin B12, and why? Why? Why does this happen? High sugar, neuropathy, vitamin B12. Oh, okay, perfect. Diabetes, okay, diabetes, vitamin B12, Abe's dorsal. Right, we're done with this one. One down, gentlemen. We are one experiment down. Let's head on to experiment 6. Let's update this a little. Boom, interact. 1 is 1 out of 8 down. Yo, that's pretty cool, bro. Should I use a phone after every chapter? No. After every 2 chapters, I'm allowed to use my phone. Examination of motor system. The main goal of motor system examination is to determine if any component of motor system is damaged. Whoa, crazy. The motor system consists of major motor areas of the brain, upper motor neurons, lower motor muscles. Body function related to the movements of different parts of the body. Movement depends on the maintenance of posture and balance. A balanced posture provides a stable background for movement. Following terms are used when different components of the motor system are damaged. Hypertonia, increase in muscle tone. There are two types. Clasp knife. Okay. Can't really see that, but hypertonia, increase in muscle tone. Two types of hypertonia. Clasp knife or spastic rigidity. Lesion in cortical spine. Cogwheel. Okay. Cogwheel, hypertonia, two types. Let me have a look at this. When you bend the limb quickly, you feel strong resistance. There's also elasticity. Hard is shut at first, but then it snaps shut easily. Oh, that's why it's clasp knife. Clasp knife rigidity. Elasticity. Cogwheel rigidity. Just feel like a bumpy ratcheted gear. What happens when the brain stops? There's upper motor neuron. Elasticity. Clasp knife rigidity is an upper motor. Basal ganglia. Hypertonia. Hypotonia, decreasing muscle tone. Poliomyelitis. Continuous passive partial contraction of muscle. Hemiplegia. Paralysis of one side of body, especially of arm and leg, and usually paraplegia, paralysis of both legs. Quadriplegia, all four limbs. Okay. Hemi, half body, para legs, quadra, all four limbs, ataxia, imperfection of course. Yo. Hypertonia, increased muscle tone, spastic. Hypertonia, decreased muscle tone, poliomyelitis. Hemiplegia, paralysis of cardiac. Ataxia, imperfection of coordination. Of aphasia, absence of speech, dysphasia. Pronounced difficulty in articulation. Dysarthria. How do you pronounce that?
Dysarthria. Dysarthria.
Dysarthria. Dysarthria. Okay, dysarthria. Difficulty in articulation of speech. Dysarthria is difficulty in articulation of speech. Dysphasia, disturbance of speech. Absence of speech. Okay. I like these terms. Poses on the right side. Introduce yourself. Take consent. Following test one by one. Bulk muscle. Measure the bulk of muscle by measuring the circumference of the limb or the tape at the end. Right. Inspect and palpate different muscles of the body and note any weak muscles. Look for asymmetry and deformities. Yikes. Examine the hypertrophy, wasting, lesion, and movement restriction. Bulk of muscles, tone of muscles, strength of muscles. So how big they are, the tone, and the strength. Okay. So for hypertrophy, wasting, physical. Okay. Tone of the muscles. Test the tone of muscles by passively moving the limbs at different joints at full range. Test the tone of muscles by passively moving the limbs at different joints at full range. Test the tone of the muscles. Test the tone of muscles by passively moving the limb. Different. Note the resistance. Okay, I don't understand. Is there a diagram? Yes, I think this is. Never mind. Testing the muscles. Okay, I don't know what that is, bro. Honestly, whatever. Oh shit. No, 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 no. I was lacking. Using my phone. My bad. Bulk of muscles, bro. I don't get this shit, bro. How am I testing the tone of muscles by passively moving the limbs at different joints? How am I passively moving them? Full range, slowly and quickly. Bro, I don't get this shit. Whatever. It's not gonna come to the exam. Strength of the muscles. Test the strength of different muscles by asking. Carry out the action of muscle offered by the examiner. Okay, what? Hold the subject's hands as if shaking hand, and use the other hand, the elbow. Um. Okay. Right. Hold the subject's hand as if shaking hand, and use the other hand to support the elbow. Okay, so doing something like this. Yo, what's up? Rotate the forearm and flex and extend the wrist. Yo, what am I killing him or some shit, bro? Rotate the forearm.
Sure. To whom?
Yo, be quiet. Rotate the forearm and flex and extend the wrist, elbow and shoulder varying speed. What am I doing? What? Flexor of the fingers. Ask the subject to squeeze the examiner's index and middle finger. Subject to bring tips of his fingers towards the front of the. Make a fist. Examiner tries to forcibly extend the wrist. Subject. Make a fist, and the examiner tries to forcibly extend the wrist. Extend the wrist against the subject's effort. Weird. Brachioradialis. Place the arm of subject midway between prone and supine positions. Midway between prone and supine position. Ask to bend forearm arm against resistance. Bend the forearm. Biceps. Ask the subject to bend up the forearm against resistance. Okay, tricep, straighten out. Okay. Pectoralis, the subject stretches arms out in front of him and clap his hands together while examining. apart. Serratus anterior. To push forward with his hands against resistance. Wing of the scapula. Latissimus dorsi. Ask the subject to clap his hand behind his back while the examiner. Okay. Testing the muscles of trunk. Yo, there's a lot of muscles we gotta test here, bro. Answer to lie in a supine position. Ask him to lift his head from the pillow against resistance and the paralysis of the lower segment. The umbilicus moves upward, but the segment is up. Bever's sign. Yo, Bever's sign. I don't like this. I generally don't like this one. This is the worst experiment out of all of them, probably. So he's laying down, lift his head from the pillow. In the paralysis of the lower segment, the umbilicus moves upward. But when the upper segment is involved, the umbilical... Actually, that makes sense. If the lower is paralyzed, okay, of course the up one is going to pull it up. If the upper is paralyzed, the lower is going to pull it down. That's a bit Beaver's sign, whatever that sign is. In weakness of the abdominal muscles, the patient would be unable to sit up in bed from the supine position without the aid of his arm. Winke's rising up sign. Or it might just be... okay, muscles of the back. Weakness of... okay, weakness of the muscles. Muscles of the back. Ask somebody to lie on his face, then ask him to raise his head from the back and stand up. Trapezius shoulder resistance. Okay, testing the muscles of the lower. Begin by rolling or rotating the leg from side to side. Rolling or rotating the leg from side to side, then briskly lift the knee to a flex. Plantar dorsiflexion. Ask the subject to elevate or depress the distal plantar. Ask the subject to bend the knee and then press the extensors of the knee. Ask the bend the knee and then press the shin with your hand. Again, flex with the knee. Left hand, right. Bend is okay. Flexors of the extensor of the hip. Then the subject's foot is lifted off the bed. Flexors of the thigh. Then the patient is asked to raise his leg off the ductors of the thigh. Ductors of 0, 1, 2, 3, 4, 5, 0. Complete paralysis. 1 flicker of contraction only. Okay, 5 is normal power. Let's go down then weaker. Grade 4 is there's some degree of weakness. Usually has a poor, fair, or moderate strength. Grade 3, the limb can be bent against the force of gravity, but not against the examiner's. Okay, grade 3, the limb can be... Grade 3, the limb can be bent against the force of gravity, but not against the examiner's resistance. Hmm. Grade 5 is normal power. Oh, grade 5 normal power, there's degree of weak. 3 is bent against the force of gravity, not against the power. Degree of contraction. 4 is weakness. It's again can be bent against the force of gravity, not against the resistance. Only when the gravity is excluded. Taking direction fixes superficial, deep, and Superficial reflexes, deep reflexes, visceral reflexes. Test for coordination. Test of coordination of muscle. Ask the subject to touch coordination now. Subject touch his nose first with eyes open, then closed eyes repeatedly. Finger nose test. Ask subject to touch his nose first, and then the examiner's forefinger with his forefinger. Flex his elbow to a right angle, and the alternate supinate and pronate is formed. Flex his elbow at a right angle, and the alternately pronate is formed as rapidly as possible. Or rotiola. In this diadochokinesia, the movement are slow, awkward, incomplete, and irregular. In addition, the rhythm of the movement in these currently coordination can pressing or handling a book or picking up pins. Coordination can also be assessed by everyday movements like threading a needle. Finger nose test. Then there's that test. Rotiola test or finger nose test. Lower limbs walk in a straight line. Favorite one side of line. Kneel heat test. Subject. Movement. Romberg sign. This test is for loss of positions. There's not a test. Test is for loss of position sense. There's not a test. Function. Ask the subject to stand with his feet. Romberg sign. Eyes are closed. The test is for loss of position sense, not a test of function. Okay, I forgot. I'm just reading. I'm not focusing. Romberg sign is for loss of position sense. We can do this. Observe gait by leg and feet. Answer examiner and turn around. Walk at all, whether you could walk in a straight line. Somebody's involuntary movement. Note any involuntary movements of subject that occur either at rest or movement. Involuntary movement. Note any involuntary movement of subject that occur either at rest or during voluntary movement. Different involuntary movements are epilepsy, lungs, tremors, fine. Epilepsy, myoclonus. What is myoclonus? Muscle twitches or jerks. Myoclonus. Epilepsy, group of disorder. Myoclonus, tremors, fine tremors, in anxiety, habit, coarse tremors. Intentional tremors, in cerebral disease, unintentional tremors, Parkinson's. Fine and coarse tremors. Tremors, fine and coarse tremors, intentional and unintentional. Hysterical, intentional. This is a slogan involving breathing movement. Athetosis, chorea, 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 dance, chorea. Oh yeah, choreo practice, chorea. Hemibellismus. Heard this, hemibellismus. Movement of a sudden, involuntary, violent flinging movements. subthalamic nucleus in the brain's bit. I mean, ticks. What are ticks? Ticks. Vocal tick. Each answer subject repeat a sentence put forth by the examiner. Always approach the right side. Greet gently. Perform the procedure. Warm your hand. Subject is to perform for comparison. And keep the comfort. Okay. 25 questions, by the way. Define muscle tone. It is the continuous passive contraction of muscle bending postures. Distinguish between spasticity and rigidity. Types of hypertonia. In which condition of spasticity? Okay, in spasticity, what occurs is this is damage to the corticospinal tract. Okay, and upper motor neuron lesion. If continuously contracted muscle. Upper motor neuron. Uniform resistance. So, oh yeah, class. Plasticity is like the pocket knife. I lost. And rigidity, there's two types. There's lead barrel and cobweb type. Uniform resistance. Velocity dependent resistance to stretch. Uniform resistance independent of velocity. Independent. Neuron, and this is basal gang. In between spasticity, okay. Define hemiparesis. Hemiparesis. Weakness on one side of body. Hemiplegia. Paralysis on half. I have two tests of coordination. A finger and nose test. Heel to shin test. Heel to shin test. What is hypertrophy, hyperplasia, and atrophy? Hypertrophy increase in muscle size due to fiber enlargement. Hyperplasia increase in muscle fibers and decrease in muscle size due to rigidity. Increase resistance. Creating muscle power. No contraction, flicker of movement. Movement without gravity. Movement against gravity. Much strength movement against. Some resistance, movement against gravity, movement without gravity, flicker of movement, no contraction. Mm. Okay, grade 5 is normal strength, movement against some resistance, movement against gravity, movement without gravity, flicker movement, no contraction. Normal is 5. What is the major descending motor tract? Corticospinal tract. What are these, like, how is this freaking physio? Name some extrapyramidal. Rubrospinal, reticulospinal, vestibulospinal. I don't like this. Rubrospinal, reticular, vestibulospinal. Ectospinal. What is the primary motor area of the cortex? Rodman area 4. What is paralysis and paresis? Paralysis, complete loss of muscle function. Paresis, partial loss of. Okay. Why do When does whining of scap? Whining? Am I reading this wrong? I think they mean winging. No. Yeah, winged scapula. Serratus anterior, long thoracic nerve injury. When is Saturday? Radial nerve fallacy, right? Yo, these are like some first year questions. What is chorea? Give the example. Rapid Huntington's disease. Athetosis, slow writhing movement. Athetosis. Athetosis. Writhing. Athetosis. Fallacy. Hemibullissimus. Sudden flinging, violent movement of the limb due to subthalamic nucleus lesion. Wow. We can revise this in the morning, even Parkinson, bradykinesia, rigidity, dressing, tremor, impulsion, stability, tremor, involuntary rhythmic oscillation, type resting tremor and action tremor. Abnormal gaits, spastic. I don't like this. I don't think I'm gonna talk about. Waddling gait is muscular dystrophy. Festinating. I don't think it's called festinating gait, bro. I don't know. I'm gonna revise this in the morning. I'm not gonna do the gates. Not worth my time. What are the different aspects of motor functions that assess one? I mean, motor system. Muscle bulk, tone, power, coordination, reflexes, and gait. Muscle bulk, muscle tone, muscle strength, muscle coordination, and gait. Reflexes and gait coordination. How do you measure the bulk of muscles in upper limb? 4 bony landmarks. Mid-arm, mid-thigh, mid-calf, wrist. Mid-arm, mid-thigh, mid-calf, and wrist. Okay, sure. Estimating hand strength of a hand under the adduction. Accessing trunk muscle strength. Observe posture, flexion. Observe posture, flexion, extension movements. How do you assess the strength of extensors and flexors of the knee and thigh? Test flexion and extension against resistance, seated or lying position. We're done with 2. Let's just have a look. Opponent's policy. Can do that. Testing abductor policy. Yo, why are we doing this now? Shouldn't we have done this last year? I'm not even kidding. Testing biceps. Okay, you're testing grip, testing triceps. There. Testing muscle deltoid, testing supraspinatus. Testing eliciting Babinski sign. That's my mom calling me. Hello, assalamualaikum. Yo, what's up, bro? How to do anatomy? Bro, I'm gonna tell you what happened. You don't gotta do anatomy. Just wait. It depends on your roll number. मैं गया था, ठीक है, मैं एंड में बैठा था, ठीक है जी, वेट कर रहा हूँ जी, मैम आज बीन है, मैंने बोला आज खेल ख़त्म है, वेट कर रहा हूँ जी, MCQ कोई क्वेश्चंस भेजेगा, कोई नहीं भेज रहा। आई स्टार्ट बैगिंग इन द ग्रुप, यार कोई भेजो भेजो, किसी ने भेज दिया, मैं गया बाहर वॉशरूम में, क्वेश्चंस थे, मैंने 7-8 मैंने याद कर लिए, ठीक है, मतलब पूरे प्रॉपर रट लिए मैंने, और उनकी लोकेशन भी सब कुछ। बैठा, फिर मैं मैम पूछती है, हाँ जी यार आपकी शर्ट ब्लू बहुत है, मैंने बोला ब्लू, अच्छा हाँ, असल में मेरी अम्मी घर में नहीं होती, मैं अकेला होता हूँ, आई जस्ट स्टार्टेड लाइक, मतलब उनको बोलना शुरू हो गया कि ओ मैं अकेला होता हूँ, तो मैं खुद धो रहा था कपड़े, तो मैंने मिक्स कर दिए, तो शायद इसलिए कपड़ा मेरा थोड़ा ब्लू हो गया। कह रही थी अच्छा नहीं बेटा आपकी अम्मी नहीं है, फिर भी आपको करना चाहिए। मैं कह रहा हूँ हाँ हाँ, मैं 1.5 साल से ऐसे ही कर रहा हूँ, मैं आज इस बार पहली बार हुआ है, मेरा ख्याल है मैंने सर्फ अपना चेंज किया, तो मैंने ऐसे, आई एम जस्ट सेइंग रैंडम शिट, अभी ये वाइवा के दौरान बात हो रही है मैं मजबूरी से। फिर शुरू करते हैं, वो बोलते हैं कोई सुपेरियर ऑर्बिटल फिशर है, वो मैंने पूरा रटा हुआ था, सुंदर क्या गुजरता है, मैंने वो बता दिया। वो कह रही वाह जी वाह शाबाश। अच्छा मैंने एनाटॉमी नहीं पढ़ी, बिल्कुल नहीं पढ़ी, वो खाली वो जो किया था ना ये चैट GPT से, लिटरली वो बाथरूम में जाके मैंने वो सारा याद किया था। उसके बाद अगली चीज़ जो है कहती हैं सर्कल ऑफ विलीज की जो भी आर्टरी है सब बताओ, सब बता दी मैंने। वो जो भी रटा हुआ था ना, पहले 5 सवाल जो मैंने रटे हुए थे वो किए थे। उसके बाद वो समझ रही थी मैं कोई बड़ा लाइक स्टूडेंट हूँ, ठीक है। अब वो डीप घुस गई फिर। 10 सवाल आगे पूछे, उनमें से एक भी नहीं आता। मैं कह सॉरी मैम, सॉरी मैम, सॉरी सॉरी। खत्म। वो कह रही थी बस ठीक है ओके जाओ। वो खुश थी, लेकिन मैं, मुझे मतलब बिल्कुल समझ नहीं है कि मतलब क्या। ऑस्पी का यार मुझे नहीं पता, जनरल में ही मैंने खाली हिस्ट्री की स्लाइड्स की थी मैंने बस, उसके अलावा मैंने कुछ नहीं किया। ये है कि डायग्राम्स जो हैं वो रिपीटेड है। जो पहले ऑस्पी में आई थी वो इस ऑस्पी में भी आई थी, बस वो जो पिन पॉइंट होता है वो डिफरेंट चीज़ में किया है। तो जो एम्ब्रियो डायग्राम्स हैं वो सेम थी। तो बस वो अपना मार्कर उन्होंने कहीं और लगा दी। तो बहुत आसान डायग्राम है यार, वैसे मैं काश पढ़ लेता। डायग्राम्स जनरली बहुत आसान थी। तो बस कर लो यार। मैं अभी ये फिजियो कर रहा था। फिजियो ऑस्पी कैसी थी बताओ ज़रा। फिजियो ऑस्पी कैसी है? ये जो सारे टेस्ट है इनमें से कुछ किया था ये जो मैं अभी बिलवा जाएंगे टाइम ज़ाया कर रहा हूँ उस पर? बबिंस्की साइन पता नहीं क्या फलाना डिंगा। एक्सटेंसर ऑफ हिप, क्या बकवास है यार। फ्लेक्सर ऑफ नी। यार मैं ये कल कल ही देखूंगा। होता है ना क्लास शुरू होने से पहले जो पढ़ लेते हैं वही मैं करूँगा। अभी तो दिल नहीं है इस पे। इट्स रेपुटेशन। क्या रेपुटेशन? ऑस्पी बता दो कंपोनेंट्स। यार ऑस्पी क्या मतलब, क्या बताऊँ? हमेशा जो होता है वही होता है ना, क्या बातें कर रहे हो यार। डीप रिफ्लेक्सेस इन सीएनएस इंपॉर्टेंट। डीप रिफ्लेक्सेस कहाँ है? ये सुपरफिशियल आ गए हैं, ऊपर छोड़ दूँ? मतलब ये जो सारा मसल वाला था ये उसमें से कुछ नहीं आया। जो मैं उसकी बात कर रहा हूँ, ऑब्जर्व की। अनऑब्जर्व को तो वैसे भी आसान ही होता है, उसे छोड़ो। ऑब्जर्व में आया था या नहीं? 7 या 2 में उसको, 2 ख़त्म। ये देखो मैंने नया बनाया है यहाँ, बड़े मज़े का चेकलिस्ट। मोड्स वगैरह लाइक सीक्वेंस। क्या मोड्स वगैरह लाइक सीक्वेंस? मोड्स वगैरह लाइक सीक्वेंस क्या बोल रहे हो यार? सेंस बनाओ। अच्छा, examination of superficial reflexes. Reflex action is an involuntary response of effectors. Involuntary response of effectors to inappropriate stimulus without conscious thought. Involuntary response है, appropriate stimulus है, conscious thought नहीं है। ठीक है जी, ये reflex आ गया। Concord modify the brain. Superficial reflexes are polysynaptic and dependent on the integrity of corticospinal tracts, which exert a tonic, excitatory influence. Blah blah blah. Reflex art for superficial reflexes is complex. यार तब है, टैब है, टैब है यार, क्या बोल रहे हो? तब है, टैब है। वो व्हाट आर यू सेइंग? कॉल पे आओ, कॉल करो मुझे, मुझे समझ नहीं आ रही है। टैब है, कॉल मी। अच्छा, um the reflex arc for superficial spinal reflexes complex. Tell me what you had an OSP like for... यार कॉल पे आओ, मैं बताता हूँ, समझ नहीं रहे तुम। Afferent impulses, आप यहाँ आ जाएं from start to end। कॉल पे आओ, कॉल पे आओ, मैं बताता हूँ। Afferent impulses from skin and mucous membrane enter the... Wait. From skin and mucous membrane enter the spinal cord through dorsal root, ascending dorsal column, spinal thalamus tracts. These impulses end somewhere in midbrain, thalamus, or cerebral cortex. Efferent fibers are carried by corticospinal and extrapyramidal tracts. Spinal thalamus, cortical, blah blah blah, to the interneurons and anterior horns of spinal cord. Interneurons and anterior horns. Bro, whatever. Wait. Hello? What's the powerhouse of the cell? Mitochondria. Amar Sohail. अच्छा,
और मुझे बता कि
क्या?
स्टार्ट से क्या सीखी?
Yo guys, we have a
हॉस्पिटल
fan. We
का
have a fan on call, live call. अच्छा sorry. क्या
क्या
क्या क्या क्या पूछ रहे हो?
मैं पूछ रहा हूँ हॉस्पिटल शुरू से क्या ए टू जी
देखो A to Z पहला जो था ना वो था स्पाइनल कॉर्ड, ठीक है, उसके बाद था सेरेबेलम, उसके बाद था
नहीं स्लाइड
पेरिफेरल
एक्स्ट्रा
नर्व,
स्लाइड्स लो
उसके बाद था कुछ और था मुझे याद नहीं आ रहा। क्या?
ठीक है एक्स्ट्रा स्लाइड लो एक्स्ट्रा
हिस्टो
स्लाइड लो
स्लाइड यार
उसके बाद
7
क्या
स्लाइड्स हैं वो यार, वो लिटरली
अच्छा उसके
5 मिनट
बाद
में
क्या
रट
है
लोगे
मैं वो
उसको।
कहता हूँ ना उसके बाद क्या क्या चीजें करनी है
उसके बाद वो
एक्स्ट्रा स्लाइड
मॉडल्स
के बाद
मॉडल्स हैं यार, मॉडल्स हैं बस।
मॉडल्स सारे जो है वीडियोस बनी उनकी है
हाँ हाँ बस वही, और काफ़ी आसान है वैसे, मतलब मैंने जो किया था वही, मैंने तो कुछ किया नहीं था, जो लोग मुझे बता रहे थे मेरे से पहले उनमें से ही आई थी चीज़ें, मतलब मैं मतलब मेरा फिर भी इतना अच्छा नहीं हुआ वो वाला पार्ट,
अच्छा
लेकिन
तो
मतलब अगर
मॉडल्स
तुम
के
पढ़ोगे
बाद
तुम्हारा चिल होगा, चिल सीन है।
ठीक है मॉडल्स के बाद
मॉडल्स के बाद जो है मतलब वो फॉसा के थे, एक कैडावर है खाली, और
एक कैमरा
हाँ एक कैडावर है बस, मॉडल्स हैं डिफरेंट पार्ट, उसमें सेरेबेलम एक आता है, उसमें सेरिब्रम आता है, और कोई पॉन शॉन्स मिड ब्रेन इस तरह कोई आ रहता है, कोई फॉसस आते हैं, जो फॉसस के 2-3 वो आते हैं, 2-3 पार्ट्स आते हैं,
फिर
फिर डिफरेंट फॉसस के अंदर कौन सा फोरामेन है, उसके अंदर से क्या गुजरता है, इस तरह के सवाल भी हैं।
ठीक है
उसके अलावा फिर बस 3 वो हैं हिस्टो के डायग्राम्स और ख़त्म। 13
यार
स्टेशन
तो
है, बस 13 स्टेशन है।
अच्छा तो कितनी चार स्टेशन स्टॉक है
देखो 4 हिस्टो के हैं, 3 एम्ब्रियो के हैं, 4 3 7 हो गए, एक कैडावर है 8 है। उसके बाद बाकी 5 जो हैं फिर वो एनाटमी वो मॉडल्स हैं, उसमें से मेरे ख्याल में 2 फॉसा थे, 2 और फिर यानी फिर 3 बचते हैं, 3 बाकी चीज़ें थे, एक सेरेबेलम था, 2 फॉसा के
हाँ
आगे एक सेरेबेलम आ गया, एक सेरिब्रम था और एक कोई मिड ब्रेन था, बस।
तो कि मिड में डायग्राम नहीं है टेबल करने की
डायग्राम शायग्राम कोई नहीं था, बस वो प्रॉपर मॉडल पड़े हुए थे,
ठीक है
डायग्राम बस एम्ब्रियो के थे, उनमें से एक क्लिनिकल था।
मैंने सिर्फ अभी मैंने फोसस कर लिए हैं तो मैंने सिर्फ अभी हिस्टो स्लाइड्स करनी है मॉडल देखने हैं ड्राइवर देखना नंबर भी
बा
डायग्राम्स
हाँ ख़त्म, पास इजी।
और रात को मैं ओए क्या कहते हैं जब मैं कर लेता हूँ मैं सारा वाइवा
हाँ मैंने वही किया ना, मैंने चैट जीपीटी किया।
मैं सोच रहा हूँ मैं मुझे देख मुझे आती तो है ना यूरो मैंने की भी है
Let's
सारी
do a friendly
मेरे भाई
fade.
की
Pull up DHA phase 6. What's a friendly fade, bro?
क्या
कोई chat में कोई कह रहा है. Let's do a friendly fade. What's a
ओए
friendly?
वही जा रहे हैं
हाँ करेंगे जाएंगे, क्यों नहीं जाएंगे ट्यूसडे को. Friendly fade, consensual amateur sparring match or friendly fight between peers in pass or blah blah blah. क्या बंदा कह रहा है आओ मेरे साथ बॉक्सिंग करो चैट में, कोई सुन रहे हो?
लेट्स डू
हाँ
डीजे आ जा मेरे साथ करेगा तेरे साथ करेगा
मेरे साथ करेगा. ओ यार बताओ मुझे, वो फिजियो वाला जो है, क्या कितना टाइम लगा तुम्हें ये करने में, ये प्रैक्टिकल्स कौन से इंपॉर्टेंट है? 8 है ना, मैंने अभी 2 कर ली हैं।
बहुत आसान है यार वो कहीं नहीं फिर इतने आसान है आखिरी टेम्परेचर इतना आसान है ऑटोनॉमिक नर्वस सिस्टम इतना आसान है तो बहुत आसान है
बस ठीक है ना, रोना बंद करो फिर।
हाँ 2 घंटे लगेंगे जी मैक्सिमम
हाँ 2 घंटे ही लगेंगे, मैं टाइम ज़ाया कर रहा हूँ वैसे, सही बात है, लेकिन और फिर
हाँ
उसके
अच्छी
बाद
तरह पढ़ रहा है जैसे
वाइवा भी हो जाएगा यार, तो मुश्किल काम नहीं है, बस मैं 2-3 वो करूँगा, बाकी आसान ही है।
अब इजी है तेरा आखिरी नंबर नहीं
मेरा
है
आखिरी है,
तेरा आखिरी नंबर है ना
आखिरी के करीब ही
हाँ
है।
तेरा कामिल के बाद
कामिल के पास है, बस चल सीधा फिर, कोई भी हो यार, आलमगीर भी आ
ठीक
जाए
है
मुझे क्या है, सर आलमगीर भी आ जाए मुझे क्या है।
हाँ चल सही है पढ़ रहा है
हाँ
मैं पढ़ रहा हूँ यार
बढ़ो, जाओ ना यार, ये DHA फेस 6 ये बंदा मुझे वो धमकी दे रहा है.
चल सही है
क्या?
चल सही है
तो
ना
चलो ट्यूसडे करो, क्यों रो क्यों रहे हो यार, क्या मसला हो गया?
या फिर पढ़
वो
रही है
काम
मैं
अपना,
वीडियो
बस
छोड़
काम
रहा
हो गया, अपना काम खत्म हो गया, बस चल सही है.
यार मेरी फट रही है मैं भी उठाऊंगा
क्यों फट रही है यार, क्यों फट रही है, मैंने पता है सुबह गाड़ी में भी नहीं, मैं वहां पहुंच के मैंने की है, वहां पहुंच के चिल करो, कुछ भी नहीं होता.
यार
वो सर अब्दुल्ला
हाँ
कमर
इजी
तुम्हारा पहला रोल नंबर है क्या है?
सबसे आखिरी
बस बस चिल करो भाई, सर अब्दुल्ला कमर चले जाते हैं, सारे चले जाते हैं एंड में, फिर मैम वो फायजा मैम महवेश मैम तैयबा रह जाती हैं, बस चिल करो, और माजमीन.
क्या चल बोले कि यही थ्री है ना कवर चाहिए
ओए होए.
I want sir एक ही
तो आप जाके बोलो सर आई वांट यू शुरू में जाके बोल दो तुम्हारी फाटेगा
मुझे मैम तैयबा मिली ना मुझे मैम तैयबा मिली मैम मार जो मैं जो साहब मार तो मुझे नहीं कहते भाई बंदे नहीं है
हाँ चलो यार पढ़ो
डायरेक्ट ना
हाँ पढ़ो
चलो
चलो अल्लाह हाफिज़ चलो ये reflex हो गया. The common superficial reflexes include spinal origin, abdominal reflex, Babinski's reflex, capillary reflex, rheumatic, bulbocavernous. Does this phrase B2B sauce? Back to best sauce ring? And he goes, nah, bro, I'm a burger. मैं burger हूँ. Sorry. B2B sauce. Back to back sauce. No idea. अच्छा जी. Anal reflex, iliospinal reflex, cranial origin, conjunctival reflex, corneal. Spinal में ये आ गए. Cranial में ये आ गए जी. Conjunctival reflex, corneal reflex, pupillary reflex, pharyngeal reflex. Oh, these are a lot of reflexes, bro. Do all of them? Hell no. ऐसे सारे नहीं है. सारे नहीं है. सारे नहीं है. Let's see. Spinal में abdominal, Babinski, scapular, cremasteric. I don't like this. Whatever. Abdominal, Babinski, cremasteric, scapular, anal, bulbocavernous, ciliospinal. Cranial origin is conjunctival reflex, corneal reflex, pupillary reflex, pharyngeal reflex. Yo. Superficially dependent both function upper and lower motor pathways and spinal cord. Loss of a particular reflex indicates the site of lesion in the corresponding spinal segment or cranial nerve. I'm moving to a new place called the Sauce Apartments. Yo, that's crazy, bro. Amar Sohail. W shit, bro. That does ring some bells. Amar Sohail. Do I know you? Amar Sohail, Amar. I don't know, man. I don't know you. Outer receptor of a as a basis. Glad it rang some bells. Yeah. Can you get the site of lesion? Superficial reflexes depend on both functional upper or motor pathway. Loss of a particular. Okay. Tactile stimuli from the skin and mucous membranes cause person. Learn reflex. Okay. Superficial reflexes of cranial origin. Subject cotton wool swab stick. All the methods described. Examination. Cranial nerves in relevance. Clavicorneal pupillary. Conjunctival corneal pupillary for the Alright, we're doing spinal origin first. Key or blunt pointed object. Abdominal, lie down in comfortable position, expose the abdomen, xiphoid cervical pubic symphysis, stroke gently and briskly with the abdominal skin. Risk ripple of contraction will be evidence the person is thin, obviously. It is often to elicit abdominal release. Yep. Spinal segments involved this T7 to T12. Alright, okay. T12. T7 to T12, okay. These spinal segments and corticospinal tract. Absent reflexes considered upper motor neuron lesions. Spinal cord damage. Plantar reflexes lie down in a supine position. Ouch. Partially reflex the arms the leg just above the ankle. Relaxed and sleep couch. Partially flex the lower limb of the leg just above the ankle joint. Flexors a little bit of jump. Foot. The blunt object. Oh, okay. Let's go from the heel to little toe on lateral board. Inhale the other side similarly produce extraction of tensor fascia lateral, like contraction of the adduction of the thigh. All four toes with increasing flex down together. Flexor plantar response. Corticospinal tract. As an extensor, Binsky. As extensor plantar response, Babinski's sign is a pathogenic feature upper motor neuron lesion in which dorsiflexion of great toe proceeds. Follow it. L5 to S1. T7 to T12, L5 to S1. T7 to T12, L5 to S1. Scapular reflex skin is in the region is stroked gently with a blunt object. The contraction of scapular muscle will be visible. T5 to T1. Okay. T7 to T12, L5 to S1, L5 S1. That's a Babinski. Now scapular reflex C5 to T1, C5 T1. Premaster reflex. Reflex is subject by stroke. Aspect of the L1, L2. Iliospinal reflex. The skin of the neck of the subject is pinched by. Response is visible at the dilation of the view. Iliospinal reflex. Skin of the neck of the subject is pinched by the finger. Dilation of the view. Reference or this one. Audible. An object. Negative spinal tracks. Image pathway reflex action receptor sensory neuron vector. Why does newborn and infant up to 1 to 2 years? Fact. We're done with 3. I'm gonna order. Boom. I'll be right back. I'm gonna order some shit. The king awaits his return. The king comes back. Whoa. What's going on, guys? We are back, everybody. Woohoo! La-di-da. We are back. We have eaten some food. I am full. Oh yeah, time to study. I'm pretty behind in terms of scheduling. Like, I'm going much slower than I usually do. At this point, I don't really care. It's the last exam, and it's physio, like, shit, you know? So, hold on, guys. Important message. Oopsie, I might have to be. Okay, I'm back. My bad. Oh, what you doing, Mr. Sasha? What you studying? How's shit been? Let me turn on the classical music. Hold on. Now it's more like, let me resume the timer. Interact. Start. By the way, I made these timers and shit from ChatGPT. Like, you see all this checklist on the right side? Timer. I just asked it to code some HTML for me. Literally in like 5 seconds I made this. Pretty cool ass thing, bro. Look at the checklist. I can like edit it. I'm done with this. Let me interact with this. Boom. We're done with 4. Pretty cool, bro. I love this shit. I'm listening to classical music. It's copyrighted. That's why you can't hear it. I seem autistic. Understand? Okay, so what is the reflex arc? I don't know. Some sort of input that happens. Quick voltage response receptor, sensory neuron characters, integration of impulse and impulse, motor neuron effector. Signal enhances reflex response. Increase excitability of spinal motor neurons when engaging other. Increases excitability of spinal motor neurons when engaging other muscles. Whatever. I'm gonna probably revise these questions in the morning, actually, because I generally don't really like doing the game that tough. All right. Examination of cerebellar function. What you doing, by the way, Sacha? Yo, where you at, bro? I don't see your shit. Where you at? Where? Yo, where you at? Where is my bro at? Okay. Cerebellum plays a major role in coordination of rapid motor activities. Yep. So midline vermis, flocconodular lobe, and two lateral hemispheres. Yep. Vermis actually moving neck, shoulder. Oh shit. The vermis is movement of neck, shoulders, and hips. Neck, shoulder, and hips. Dog, that scared me? What you mean that scared me? What scared you? I'm using my vermis right now. I'm using my vermis. Cat. Shaking my hips too. Okay. I had my tablet open at full volume next to me. Okay. Where were you the past like 25 minutes I was speaking? Freaking monkey. How is this delayed or some shit? Like, I'm gonna say the number 5. Type it in chat right now. 1, 2, 3, 4, 5, 6, 7, 8. Are you slow or is this dead eyes that delayed, bro? No way is that. You're barely done with last paper. Where you at, bro? You're pissing me off, man. Chat faster, bro. Are you on time or not, bro? I gotta check it myself, bro. Slow ass person, slow punk ass. Hold on, man. Pissing me off, man. Let me have a look myself. Freaking monkey. Let's see the live stream. My phone's lagging apparently. Bullshit, bro. Is it deadass lagging, bro? There's not been a single dropped frame. I don't understand. Why is my phone being a piece of shit? ChatGPT getting good. Yo, how behind is this chat? Yo, how behind is this chat? It's not behind. Why are you so slow, Saad? Yo, you gotta come live. Hold on. Let me call this guy. Medium motion. Yo, you're pissing me off, bro.
What do you mean?
You're not live, bro. Click live. You're like so behind.
वही ना मैं पीछे हूँ ना बहुत ज़्यादा. I had it open and it
Bro,
for some reason
oh
it
my
buffered so
days, bro.
far back.
Pissing me off. Oh, hold on. Important call. I'm gonna be right back.
Yo, you're pissing me off, bro.
Oh, I'm back, monkey. Here we live. All right, let's finish this. Vermis, neck, shoulder, hips, intermediate, more hands and feet. The intermediate, lateral, sequencing, timing, flow control, balancing. Okay, whatever. Multiple circulatory functions. Ordinary overshoot. He's finally back. Yeah, we're finally back. Their intended mark. The effect is called dysmetria on pass point. Coordinated movements that are called dysmetria. Cerebellar nystagmus, a tremor of the eyeballs that occurs when whatever. Dysarthria, arthria, active articulation of speech. Speak slowly, deliberately, syllable by syllable, blah blah blah. Egg is pronounced angstactor speech. You're just starting now? Damn. Bro! Come on. One sec. Oh, my bad, Chai. It was my mom. Get dysarthria, can't speak, nystagmus, your eyes are freaking moving. Dysmetria, pass pointing, intention tremor. We all know this. Hypotonia is disease, decreased tone of the peripheral body muscle. Rebound phenomenon. If the resistance is suddenly withdrawn from an ongoing. What? If the resistance is suddenly withdrawn from an ongoing movement, patient cannot break the movement. Oh, so it was this one, like. Like, oh, stop it, move. Die. Decomposition of movement. In performing a complex action, more than one joint, touching the head with the finger, not done smoothly. One movement is completed. Dysdiadochokinesia, impairment of rapid alternating movements, slow, disorganized, impairment of rapid alternating movements, slow. Yeah, roti test. Oh, dysdiadochokinesia. All right, gait, reeling or drunken gait occurs in cerebellar ataxia, patient with gait disorder, blah blah, broad base, blah blah. Okay. Patellar hammer, blah blah blah. Approach right side, introduce. Yo, tomorrow's OSCE is gonna be kind of tough. Like the observed. The patient's speech is noted while he talks. Or dysarthria. Ask the patient to fix his gaze on a point of the eyes for nystagmus. Everyday movements like dressing, undressing. 3 at a time. Draw a large circle in the air with the toe. With the toe? Hold on. Yo, what is going on here? Yo. Whoa. Yo. With the toe, sorry. Yo. What is this one? Draw a large circle in the air with the toe and put a dot in the center. Oh, I gotta put a dot in the center. Oh. Oh. Boop. 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 That's crazy. Okay. We've got subject is asked to walk along a straight line. Are we gonna be like, we're gonna start talking to him, we're gonna note his speech, we're gonna point a finger, look at his eyes, anything going on with the eyes, ask him to unbutton his shirt, button it again, then tell him to get his feet up in the air, draw a circle with the feet, put a dot in the center right there. Okay, the subject is asked to walk. और फिर बोलेंगे चल लो, पाँव तो आपने हवा में तो कर लिए, अब आपने चलना है बेटा, चल लें. Okay. Past pointing. Something has to lift an object, glass of water with intention trimmer. Oh, oh. Past pointing. When the subject attempts to touch an object, overshoot finger, nose, touches nose, and the examiner for the index finger, makes sure the most time to your target finger. Timing is crucial. Moving just as the patient finger is about to leave his nose. Oh! Counting. The subject is asked to touch each finger in turn with the thumb rapidly. 1, 2, 3, 4, 1, 2, 3, 4, 1. This diadochokinesia. Heel shin ankle text. Okay. Oh, these are pretty easy, bro. For dysdiadochokinesia, flex the elbow at a right angle. Alternate supinate and pronate the forearm as rapidly as possible. Pendular knee jerk. Elicit the patellar tendon reflex. The limb will swing back and forth like a pendulum a few times because of hypotonia. So, like, it can be fixed and shit. Rebound phenomenon. The subject is asked to flex the forearm against resistance. If the resistance suddenly withdrawn, the patient cannot break movement of this way backward. Whoa! That's what's gonna happen. Yo, this is pretty easy. Chat. We're almost done with this. Romberg sign. A patient with cerebellar lesion is asked to stand with feet close together and to fall, respective eyes open or closed. Uh-oh. Uh-oh. Yo, I'm getting kind of hyped right now. I don't know why. Tandem walking, has to walk a straight line. The serious will be unable to do so. Okay. This is tandem walking. He can't tandem walk. In case of female patients, a female attendant must be present. Okay. Room should be well lit and warm. Compare findings of both sides. Patient's eyes should be closed during specific examination. Thank the subject at the end of examination for his cooperation. Thank you. Okay. Name the organs responsible for equilibrium. What's that? Vestibular something? Proprioceptors and muscles and stuff. Are slurs allowed here? Everything is allowed, but I condemn it. But you can say whatever you want. Might get banned though. You better not get banned on YouTube, buddy. Anyways, vestibular apparatus. What is the vestibular? I don't know what the vestibular apparatus is. Semicircular canals, utricle, saccule. Yo, what is this, bro? Is this physio or anatomy? What's going on, everybody? Vestibular apparatus is semicircular canals, utricle, and saccule. Yo, I'm not memorizing that. 3 types of cerebellum phylogenetically. Phylogenetically? Bro, what is this? Like the freaking cerebellum lecture in anatomy? What's going on, bro? Archiocerebellum, paleocerebellum, neocerebellum, vestibular cerebellum. So this is the flocconodular lobe. Archiocerebellum, paleocerebellum, neocerebellum. Archie Paleo Neo, 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 APN, 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 Amar, Pakistani, Nigeria, Archie Paleo Neo, Archie Cerebellum, Paleo Cerebellum, Neo Cerebellum, whatever. Okay. Name the 3 types of cerebellum. Okay, no. Name the nuclei of the cerebellum. Dendate and bullet-form globals and physiology. Fat guys eat donuts. Fat guys eat donuts. Fat guys eat donuts. What is dysdiadokinesia? Inability to perform rapid alternating movements smoothly. What are intention tremors and resting tremors? Or tremors due to involuntary movement, resting tremors, tremors, rest. Tetany, involuntary muscle spasm due to low calcium levels, often from hypocalcemia. Romberg sign, loss of balance upon closing eyes, indicating proprioceptive or vestibular dysfunction. Okay, with this vestibular semicircular canals, utricle and sacral, saccule. Semicircular canals, utricle, saccule. Okay. Dysmetria. Oh no. Spinocerebellar tracts, dorsal, ventral, spinocerebellar. What are these, bro? 2 ascending spinocerebellar, anterior and posterior. Spinocerebellar tracts. This is anatomy, man. Okay, dysmetria, an inability to control movement range, leading to overshooting. Dysmetria, meter, distance. Dysmeter, you cannot do the meter properly. Overshooting. Nystagmus is involuntary rhythmic eye movements. Yep. Tinnitus is the ear ringing thingy, right? Perception of ringing, buzzing in the ears. Source. Receptor in the semicircular canals with the what is the receptor in the semicircular canals and organs? Otolith organs. Semicircular canals, crista ampullaris, macula. Yo, this shit is not coming in the exam, right? What? Because what the freaking hell is this question? Cerebellum connections to brain organs. Inferior, middle, inferior cerebellar peduncles. Cerebellar nucleus for coordination. Dendate nucleus, coordination. Endothalamic tract. Abnormal gaits. Ataxic scissors, fascinating. Alright, ataxic is cerebellar disorder. Scissors, cerebral palsy. Cerebrum. Scissors gait, cerebral palsy. Fascinating, waddling, muscular dystrophy. Fascinating gait is Parkinson's disease. Okay, we're done with another one. We're done with 5 of these. 5 of these. There's cranial nerves. Do cranial nerves first. There are 12 pairs of cranial nerves in humans. Some carry special afferent fibers. Yo, do I gotta remember the 12? No! Bro. I don't want to study this, bro. I'm gonna take a real break, bro, because this lecture just pissed me off.
What was all that noise in your bedroom this morning?
Oh, not much.
Oi, oi. Yo.
You gonna keep staring at me or are you gonna talk about it? I'm not. I was talking to the psychic the other day. She told me I'm a redheaded girl that was just like Ariel and take her out for a night. Right now. Right now. Let's go. Come on. Yeah. So what's your favorite? So is it pink just like you? Me too. My friend's favorite.
What is going on here? Yo, makeup is crazy, bro. Hold on, look at this. Makeup is dead ass crazy, bro. Look at this. What? Insane. Makeup show.
Give you a give you a concrete.
You are good. Hi. Du bist gut. Du bist gut genug. 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 Oh, you want me to scroll? Okay, I'll scroll again. I was about to study. Time to scroll again. Oh, you guys you saw these guys on the Empire State Building? Crazy.
बच्चों यूनिवर्सिटी खत्म होगी डिग्री मिल गई आपने सबसे जरूरी काम कर रेस्ट क्यों
No rest. I'm not liking my feed right now. I'm not liking it.
Welcome to Beat and
Can you share this one? Yeah. These are horrible reviews, man. What's going on? Okay, damn, this is kind of crazy. Yo, this haircut looks fire.
You didn't take the meat out of the freezer.
Of course I did. So we're going out for dinner.
No way.
Cause this gon' make the news, gotta make your move. Talk that bitch, get in, cause she looking confused. I broke the rule, cause this.
Oh, wow. Yo, this is freaking banging, bro. I'm just gonna play this in steady. Oh, no. Yo, this is so good, bro. What the hell? Oh, examination of cranial. Did you have this, by the way? Examination of cranial nerves. Do you have this, Oski? I don't think I want to start it. I don't think I want to start it. How many questions? 20 questions. Angry? Are you angry? Cranial nerves. There are 12 pairs of cranial nerves. Oh, bro, I keep forgetting their names, bro. What is one? Olfactory, two, optic. We. Fuck. I hate this. Some carry there are 12 pairs. Some carry special afferent receptors. Oh, blah 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 blah. Huh? Extroceptive. Distance receptors. Optic, olfactory. Extroceptive. What the frick is extroceptive, bro? First time I'm hearing this. Proprioceptive. Bro. One olfactory, sensory smell. Two optic, sensory vision. Okay, that's not bad. That's not bad, low key. Three oculomotor. Why is it called oculomotor? Trochlear examined together. Why is it examined together? Okay. Movement of eyeballs, except lateral. I think because lateral was superior oblique was here. Isn't trochlear superior oblique? Am I tripping, chat? I don't know. Lateral, okay, that's abducent. I know that. Where did trigeminal go? Why is 5 here? Okay, because it's examined together. Ocular movement of eyeballs except lateral deviation, so up, down, everything. Controls size of pupil, a combination of medial deviation. Bro! So trochlear is medial, fourth is medial, sixth is abducens, that's lateral. Okay. Here, oculomotor is movement except lateral. Controls the size of pupil, whatever. Trigeminal is mixed. Sensory, facial area, partly head and neck. Motor is musculomatic. Mandible. Not bad. Facial is 7. Mixed. Sensory is taste, anterior 2/3. Motor is facial. Except levator, palpebral, superior. What the shit about that muscle? Vestibulocochlear, sensory, hearing, and equilibrium. Vestibulo. Okay, let's do it again. Number 1 is olfactory. smell. Number 2 is cranial. Number 2 is optic, vision. Cranial nerve number 3 is oculomotor. This is vision. Movement of eyeballs, lateral deviation, and pupils. Damn it. 4 is trochlear, that's medial deviation. 6 is abducens, that's lateral deviation. 5 is trigeminal, has sensory and sensory is in the face, then the jaw and the neck. Hardly had a neck. And then motor is in the muscles of mastication. Facial nerve is number 7, mixed sensory anterior two-third of taste. Motor is facial muscles. Okay. 8 is vestibulocochlear. So hearing and equilibrium. And then 9 is pharyngeal. Sensory is taste, posterior one. Okay. Had taste it. Or that motor is pharyngeal muscles, secretion of saliva, baroreceptor reflex. Okay, I know that one. I know that one, everybody. I know that one. 10 is vagus. Heart, lungs, viscera. Heart, lungs, viscera. I'm just gonna remember heart, lungs. 11 accessory. Accessory was some like trapezius muscle. Yeah. Cranial and spinal. Cranial portion is larynx, pharynx. I'll say larynx, pharynx. One portion is okay, hypoglossal 12. Muscles of tongue. Bro, I genuinely hate this, bro. I'm genuinely like getting crashed out. 1 is olfactory, smell. 2 is optic, eye, vision. 3 is oculomotor. This is all movements of eye except medial lateral deviation. And this is like pupil freaking dilation or some shit. Controlled size of pupil. And then we have trochlear. After oculomotor, we have number 4, which is trochlear. This is medial deviation of eye. Then we have abducens, which is number 6. This is lateral deviation of eye. All of these are trusted together. The number 5 is trigeminal. It has sensory and motor. Sensory is the face, head, and neck. And motor is the muscles of mastication. We have facial nerve, cranial nerve number 7, which is facial nerve. Facial nerve has sensory and motor. Sensory is anterior two-thirds, tongue and taste. Motor is the facial muscles, except some random ass muscles. And then we have number 8, which is vestibulocochlear, which is balance and hearing. With number 9, glossopharyngeal. I think it was glossopharyngeal anterior, posterior, 1/3 of taste, sensory, and then was a muscle. Pharyngeal muscle. 10 is vagus. Vagus is heart, lung. 11 is accessory. Cranial portion. Larynx, pharynx. Examination of olfactory. Menthol, peppermint oil, clove oil, brothel. As subjects sit comfortably, check both the nostrils are there is no emission of nasal mucosa, no obstructions. I gotta check his nose. I'm not checking nobody's nose tomorrow, bro. As the subject closes his eyes and one of his nostrils. With the cap of the bottle containing clove oil being peppermint. And then subject must close his eyes during procedure. Familiar, do not use irritating them. Okay. Examination of optic nerve. Is there an examination of every single one of these nerves? 'Cause if there are, I'm gonna. There is it. There. Are you serious? Each of these nerves? Oh my god. Oh my. This is horrendous. This is genuine. Oh my god. Generally too. I was thinking of doing the physio. I might just do the freaking. Bro, why is there one for every nerve examination? Perimeter, scutard, jigger card, optic nerve. Brother. Oh. Oh. Field of vision. Hmm. 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 Ask the subject to sit or stand comfortably. The examiner should sit on a stool or stand in front of the subject. Yeah, here's the exam. Normal, the examiner should remain level. Finger lateral to the right of the subject. Where do you go, boys? Move your finger. Put a piece of cardboard. Examine the people who reaction. Green. Uh, 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 uh,
They didn't bring us here to change the past.
Trigeminal nerve, cotton wool, pin, green fork. Motor functions. Yeah, I'm gonna study this. Yeah, we'll do this in the morning, chat. I'm not. Balance heat protection law, but when the body and the best delivered. Oh, I can't sit no more. Oh. Oh. Oof. Changing muscle activity is one of the most important means. Thermometer is an instrument used for indicating temperature of any substance. The various types of thermometer include. Fourth. Axilla are groin for children, the mouth and rectum for conscious. Most precise is rectum. Mouth 5.5 degrees higher than axillary. Okay. Types of mouth rectum. Temperature of the mouth. Shivering. Well, 36.37. Normal is 36.2, 36.6 to 37.2 degrees Celsius, 36.6 to 37.2 degrees Celsius, 36.6 to 37.2, 98 to 99 Fahrenheit. Why do I need to know Fahrenheit, bro? Who gives a shit about Fahrenheit? 98 to 99 Fahrenheit, 36.6 to 37.2, 0.6 to 24, 2.6, 0.6, 36.6, 0.6. Subnormal 36.6 to less, febrile 37.2 or above 99. Blah, blah, blah. Hyperpyrexia above 41.6. Oh, he's dead. But hypothermia below 35 degrees Celsius. All shaken, 37 degrees Celsius. Place sprinkler part of the thermometer under the tongue. Close the nose. 100 cautions. Thermometer must be accurate. Half a degree higher than. The core body temperature. 99. Core temperature. What's wrong with the body? Fiction. Increased metabolic rate, shivering, behavior response to seeking warmth and variation of body fever. Increased body common cause infections, inflammatory condition, autoimmune fever. Pyrogens, news fever. ठीक है. Endogenous या exogenous होते हैं. Fever developed by pyrogens. These can be endogenous or exogenous. And these pyrogens act on the hypothalamus, particularly preoptic area. In the hypothalamus preoptic area, increase the cell body to increase metabolism, shivering. Difference between remittent and intermittent fever. Elevated body temperature fluctuates with not. Fever, okay. Condition. Fusion logic concept. Hard heartbeat, organ failure, da da da. Done with this as well. Last one left. Nerve with the cardiac muscles, fibers, pressure flow. Automatic cardiovascular, GI, and thermal system, cardiac muscles, smooth muscle glands, these fibers regulate blood pressure, GI movement, secretions, body temperature, bronchial dilation, blood pressure, bronchial metabolic maturation, defecation, picture, lighting of glandular secretion, two systems, second parasympathetic, being at the 132, craniosacral into L2, the spot, craniosacral. Sympathetic parasympathetic. The body are fight the parasympathetic for rest and digest, blah blah blah. The functions of sympathetic parasympathetic reflexes include effective posture and exercise on blood pressure, heart rate, tilting, Valsalva maneuver, cold pressure test, temperature design. Reflexive eye have already been discussed in the section of the however, da 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 da. Carotid reflective receptors present to all the carotid sinus on the wall of the carotid sinus aortic arch. Center, vasomotor center. Blood pressure is raised. Normal. Lie down. Lie. Close Philip. Common carotid artery. Middle edge of Lawrence. Look at the carotid sinus, which is dilation of ventral canal just above common carotid artery and lies jaw. With your left hand, palpate the radial artery of subject and record the resting heart rate of your subject. Your left hand, palpate the radial artery. Radial artery, okay? Elbows will be filled with this hand. The thumb over your right hand. With the thumb of your right hand, these 2 seconds simultaneously. Roblox or Minecraft? Roblox or Minecraft? Minecraft. Minecraft. आखिरी एग्जाम है कल ऑस्की है फ्री रह गया heart rate blood pressure ask the subject to lie down or sit on a stool, close the nostrils with nose clip, put a mouth piece between. Ask somebody to lie down on a stool, close the nostrils with nose. Put a mouthpiece between the lips and can use the mercury manometer. Place ECG under leads. 30 beats, forcing the mercury manometer for the mouth. Maintain expression at 40 for 10 to 15 seconds. Interval. Blood pressure test. Global sympathetic activation. Baseline. CBD results in significant arterial or vasoconstriction with the radio. Times over 2. People average least. Cold press at the time. Signals are sent by glossopharyngeal nerve to glossopharyngeal nerve. Biggest nerve is to heart rate. Unaortic reflexes. Solve. Vascular resistance. They help maintain blood pressure. During blood article. What is practical significance? It Oh, we are done. Done. Physiology. Titan. So I can't understand. I'm good, bro. You can rewind. I'm not repeating again. I'm just studying myself. हाँ जी मुन्ना खाला आप ज़रा तैयार कर दें ठीक है जी आप मैं आ रहा हूँ ना कल ज़रा लस्सी जो हो ना नमकीन सी हो ठीक है जी नमकीन लस्सी ते ज़रा वो जो आप बनाती है ना वो एप्रिकॉट वाला कोई कस्टर्ड वो बना दें ज़रा साथ में आपके पाए की तारीफ बड़ी सुननी है, तो पाए भी आप बना दें। तो हुसैन जी भी कह रहे थे कि पाया आप काफ़ी अच्छी बनाते हैं, तो पाए बना दें तो लस्सी बन गई, तो आपका जी खुबानी का कस्टर्ड बन गया। तो मैं जी कल आ रहा हूँ, ठीक है जी, शुक्रिया। अह, break. चलो जी, मैं ब्रेक ले रहा हूँ, थोड़ी देर बाद आता हूँ।